Okay, so by the way, did you already have your MCN concept?
Yes,
Yes
ma'am.
po, ma'am.
Okay, so this won't be new to you. Okay, so bali we will be focusing on nutrition in pregnancy so that in the event that you will be handling uh, OB cases, especially pregnant women, and you would want to give health teachings on their nutrition, then you will benefit from this lecture. Okay, so at the end of this lecture, you will be able to describe the physical changes and nutritional health concerns during pregnancy, enumerate the benefits of breastfeeding to the mother and baby, formulate health teachings to achieve required nutritional level, to address physical health or health concerns during pregnancy and lactation, and apply for the four aspects of meal planning and my plate in modifying a meal. Okay, so you will be having an activity on meal planning for pregnant women. Okay, so hopefully may time tayo next week. But if not, I'm just going to have that as offline activity na lang. But of course, as always, by group ni siya. Okay? Okay, so disclaimer, since I just had, heads up lang, I just had coffee, so you might hear yung mga unusual, um, yung mga gurgling sounds, no? Because, atake na naman yung hyperacidity ko. So, sorry in advance, di jud na ko mag-control. Okay? So, sorry lang talaga sa mga naka-headphones or earphones while nag-listen sa lecture, just in case na jud mo madunggan. Okay? So, gestation. So this is the period from conception to birth, and that is 38 to 42 weeks or 9 months of pregnancy. And as you know from your MCN concept, it is divided into 3 trimesters and has 3 events or periods. Okay, so again, this is nothing new to you. So first we have the implantation period. Okay, so the fertilized ovum implants itself in the uterus and begins to develop, and this occurs during the first 2 weeks of conception. So the source of nourishment here, the uterine substances, particularly uterine milk protein, the glands in the endometrium. So, sorry, your brain ang yan. Okay, so to continue, the glands in the endometrium, okay, which is the lining of the uterus, will secrete this uterine milk protein. Okay, and the progesterone will stimulate the glands to secrete UTMP, and estrogen causes endometrium to thicken to produce UTMP. Okay, so itong purpose ng pag-thicken ng endometrium is to make it, to prepare it for the implantation, para doon mag-stay si baby, okay, kung saan siya mag-implant. Now, adverse influences during this period are the following. Okay, so smoking, drug abuse, and malnutrition. Okay, so these will result to failure to implant. Mahirapan si baby magkapit dun sa lining. Okay, dun sa endometrium banda. Okay, and this could also be affected by neural tube defects, okay, or your NTDs. Okay, so this is why during pregnancy, mothers are often supplied with vitamin and mineral supplements. So here, to prevent this one, always remember your folic acid or your folate. Okay, so siya talaga yung maka-protect or maka-increase ng protection against neural tube defects. Next, we have organogenesis rather. Okay, so this is the period of organ formation which occurs from 2 to 8 weeks after conception or the next 6 weeks. This is the critical period when organs are formed and most vulnerable to adverse influences. Okay, so from the name itself, this is the time wherein the baby's organs are being generated or created. Now, for the source of nourishment, at about 8 to 12 weeks into the pregnancy, the glands in the uterine lining secrete glucose, which it stores as glycogen, and this is the source of nourishment for the baby. Okay, so Hala, okay, sorry na. Press ko yung isang button ko dito. Okay. So far, okay yung pace ko. Or am I still audible?
Yes po, ma'am.
Okay, thank you. Okay, so next you have rapid fetal growth. So this covers the last 7 months. This is characterized primarily by growth in the number of cells and size of the organs until it can support extrauterine environment. Okay, so this is the part in the mother's pregnancy that she really has to be careful. Okay, so she has to stay away from harmful substances and must also protect herself, from triggers for premature um, birth or preterm labor. Okay, so as I mentioned, no, when I had my duty in DRMC, we very very common cases sa amin yung mga patients na preterm labor. And then, they really have to be on close monitoring so that yung pinaka-goal nila is that they will be able to deliver their baby safely. Okay, so yung problem kasi pag preterm labor or premature birth, especially pag 28 weeks pababa, the baby's body is still not able to support extrauterine environment, particularly yung lungs. Okay, so the lungs of the baby rather. Okay, so to continue, okay, so source of nourishment for the baby, okay, so hindi talaga mawawala si placenta. Okay, so simple diffusion passive process in which nutrients move from high concentration into the maternal blood to lower concentration in the fetal capillaries until equilibrium is reached. So it is a mix of oxygen, carbon dioxide, fatty acids, steroids, nucleotides, electrolytes, and fat-soluble vitamins. Okay, so happy, healthy placenta equals happy, healthy baby. So that is why, especially during the third trimester, if may issue si placenta, it could be either placenta previa or abruptio placenta. It is quite dangerous to the baby. So that is why, again, dapat under close monitoring si mother, bed rest, especially for placenta previa. Okay, because any damage to the placenta will compromise the circulation and nutrition provided to the baby. Okay, so a major reason that the mother's pre-pregnancy nutrition is so crucial or important is that it determines whether her uterus will be able to support the growth of a healthy placenta during the first month of gestation. Okay, so to add to the other responsibilities of placenta, it actively gathers up hormones, nutrients, and protein molecules such as antibodies and transfers them into the fetal bloodstream. It also produces a broad range of hormones that act in many ways to maintain pregnancy and prepare the mother's breast for lactation. Okay, so ito yung one of the common health teachings or health counselings I give to mothers, especially during the postpartum period. Okay, so one of the common complaints or one of the common problems that they would claim, no, kanang ma'am, gamay kog milk. Ma'am, di ko ka breastfeed kay gamay ra yang masupsop. Okay, so I would tell them that during the 9 months that um, they were pregnant, their bodies were already producing milk. Okay, so the only thing that they have to focus on is yung stimulation. Kasi the more na ipasak nila si baby sa breast nila, the more na lalabas ang breast milk na na-store daan sa breast nila. Okay, earlier. Okay, so more on health counseling, health teachings tayo for the postpartum period, especially where breastfeeding is concerned. Okay, so habits to establish in preparation for a healthy pregnancy. Okay, number one, achieve and maintain a healthy body weight. Choose an adequate and balanced diet. Be physically active and avoid harmful influences. Okay, so ito yung mga 4 cardinal rules para ma-safe ang pregnancy. Okay, and to add also, dapat religious sila or dapat um, they have to comply with the prenatal checkup. Okay, because the purpose of prenatal checkups is for them to be able to monitor their progress and also to check for any signs and symptoms of any pregnancy complications, especially yung pregnancy-induced hypertension, preeclampsia, okay, and other conditions. Okay. Okay, so let's go over these 4 in more detail. So number 1, achieve and maintain a healthy body weight. So if your patient is an underweight pregnant, the mother will be at risk of giving birth to a low birth weight infant. So a low birth weight infant is defined as having a weight of less than 5.5 pounds. Infants have impaired growth and development. They're also more prone to infection and disease, and ultimately they will have lower adult IQ. Okay, so may bearing si low birth weight sa possible growth retardation in the child later on. Okay? So aside from underweight, we also need to discuss overweight or obese pregnant. Okay, so birth defects, okay, heart defects, and neural tube defects. Next, okay, so they will also encounter problems with diagnostic tests. So too much body fat leads to inaccurate ultrasound results. Next, ito siya, one of my favorite topics under pregnancy, itong si macrosomia. Okay, so the fetus is larger than normal and the baby has a greater chance of being obese later in life. And this is most common in GDM cases or gestational hyper um, gestational diabetes mellitus. Okay? So ito siya. Okay, so because of the overexposure of the baby to glucose in the mother system, the baby has increased intake of glucose. So, lalaki at lalaki siya while inside. But then, at the same time, the baby becomes resistant to insulin. Okay, so that is why paglabas ni macrosomic baby, they have that tendency to be hypoglycemic. And that is why pag may history of DM or GDM ang mother, it is expected na that the baby will undergo blood glucose monitoring during the postpartum period. Okay? Aside from this one, preterm birth, okay, so na-mention ko na ito. Okay, so obese pregnant may develop preeclampsia, which may lead to medically indicated preterm birth. Okay, so if masyadong advanced yung preeclampsia ng mother or masyadong pronounced or the mother would already exhibit signs of seizure activity, then going further into the um, pregnancy might be too dangerous for her and also for the baby. Okay, so that is why they anticipate preterm birth. Okay, so usually no yung birth method of choice for preeclamptic patients or even those with um, pregnancy-induced hypertension is CS. Okay, so why? Because pag hypertensive daan si mother, they are at greater risk for more bleeding. Okay, so again, remember this one. Okay, so pag pag hypertensive ang mother, especially uncontrolled hypertension, all the more na they have that risk for having heavy bleeding. So that is why the safer option for this type of patient is a cesarean section. Okay? Next, we also have here yung stillbirth. So the higher the woman's BMI, the greater risk of stillbirth. Okay, so ito siya cascading or parang siyang domino effect. So let's say na obese ang mother plus may um, Pag obese si mother or overweight, tapos may kapartner siyang hypertension plus yung GDM, that is, all those factors are quite dangerous for the baby. Kasi number one, magiging affected yung um, circulation or oxygenation sa baby. That is why, no, another one of my saddest encounters back in the gynae ward in SPMC, meron kaming patient na I think, ano siya, 6 to 7 months into her pregnancy, tapos yung diagnosis was uncontrolled hypertension. Tapos, sa latest ultrasound niya, pag-admit niya, dead ang bibidaan sa loob ng tiyan niya. So, ang ginagawa ng OB sa kanya is they had to wait for her to give birth, okay, para ma-expel si baby. Usually, pag ganun na case, they would give medications like dinoprostone to induce yung cervical ripening para mag-open pa rin si mother. Okay? Um, Whenever we had cases like that, we always had to make sure na naka-diaper ang mother. Kasi just in case ma-expel yung dead na baby, mag-cut siya ng diaper. Okay? Or we also had to instruct the mother to stay in bed. Okay? So that kung ma-expel siya, doon lang siya sa bed. Okay? So, um, there would be no risk of injuries, further injury sa mother, like if sa CR siya manganak, so no siya kanang it would be more challenging to transfer her back to the bed. Okay, so whenever we had cases like that, um, the doctor would do curettage dun sa bedside. Pero mahulog siya as dirty case, tapos nasa ward pa naman siya. So ideally, yung protocol namin back then was to be on labor watch. Okay? So yung naga-monitor kami ng IE ng patient, mura gihapon ta naga-monitor o kanang pregnancy until sa ma-fully dilate. Okay? So that ma-wheel in namin siya sa either sa main na DR or sa ER na DR. Kasi doon din siya ipa-expel ang baby plus malinisan siya, yung curettage. Okay, so yan yung protocol namin noon. Okay, so wanting to be familiarized with this one. So this is the recommended weight gains based on pregnancy weight. So for underweight, okay, so it's a BMI less than 18.5. So the recommended weight gain is 28 to 40 pounds, or that's 12.5 to 18 kilograms. For healthy weight, okay, so BMI of 18.5 to 24.9, the recommended weight gain is 25 to 35 pounds, or 11.5 to 16 kilograms. We also have here overweight. Okay, so that would be a BMI of 25 to 29.9. The recommended weight gain for this patient would be 15 to 25 pounds, or 7 to 11.5 kilograms. And then pag obese na mother, okay, for the pre-pregnancy weight, that would mean a BMI of greater or equal to 30. So the recommended weight gain for this one would be 15 pounds minimum, or 6.8 kilograms minimum. Okay, so again, familiarize yourselves with these numbers or weights rather. Okay, so pansin ninyo, pag underweight pre-pregnancy, the more na they are recommended to have more weight gain. Whereas, on the contrary, pag obese na pre-pregnancy, pag obese ang mother sa kanyang pre-pregnancy weight, then mas less yung recommended weight gain niya. Okay, so yan yung pinaka-key to remember. Wala, sunod to. Okay. Okay. So for the next slide, okay, so these are the factors that contribute to the weight gain in pregnancy. Okay, so number one, si baby. Okay, so the baby contributes 7.5 pounds. And by the way, these amounts are just approximate, mga estimate po sila. Okay, so definitely another contributory factor to the pregnancy weight breakdown is the enlarging uterus. So at 2 pounds, 2 pounds yun siya. Okay, a little bit less than 1 kilo. Okay, kasi 1 kilo is equal to 2.2 pounds. Okay, and imagine your uterus as a balloon. Okay, so lalaki at lalaki siya as the pregnancy progresses. Okay, next you have the placenta. So nag-contribute siya ng 1.5 pounds. Amniotic fluid, 2 pounds. Breast enlargement, 2 pounds. Okay, so you would notice din na pag buntis ang babae, no? So you would notice their boobs getting bigger, and that is because of the production of milk. So bale, it's their body's way of preparing for the baby's nutrition. Okay? So next, extra blood and fluid volume, they contribute 8 pounds. And lastly, yung extra fat reserves, 7 pounds. So a total of 30 pounds ang weight gain. Total of 30 pounds weight gain in pregnancy. Okay, so next, we have to choose an adequate and balanced diet because malnutrition reduces fertility and impairs the early development of an infant. Okay, so this also influences placental development, implantation, and early critical periods of embryonic and fetal development depend on maternal nutrition before and during pregnancy. So the dietary management for this one is yung pinggang Pinoy and the knowledge of the basic food groups. Okay, so I think I have this on one of the next slides. Excuse me. Okay, sorry for that one. So to continue, resting metabolic rate increases during pregnancy as a result of increased body mass. Okay, so the more that we weigh, the more energy our body needs um to to move around. Okay, and to burn down yung ating mga calories or to burn down um, to burn down and utilize energy, okay, for us to move around properly. Okay, so pregnancy-associated physiologic changes are also increased, such as cardiac output, okay, also for the growing fetus. Now, some of the changes in maternal physiology during pregnancy include increased maternal fat and total body water, decreased plasma protein concentrations, especially albumin, increased maternal blood volume, cardiac output, and blood flow to the kidneys and utero-placental unit, and decreased blood pressure. Now, low blood pressure during pregnancy happens because of the body secreting hormones and progesterone, which help to relax the walls of the blood vessels and increase the flow of blood to the mother and the baby. Okay, so it is a play of the different hormones. Okay, so it's all about hormones pag pregnancy. Okay, now just would like to insert no yung in cases of teenage pregnancy, so I've encountered mga patients as young as 13, 14 na na-admit sa hospital because of teenage pregnancy. Okay, so the worst case of teenage pregnancy was a 15-year-old. I'm not sure if I already shared this story to you, but I'll just say it again. No? So, um, yung nangyari sa 15-year-old na yun, gi-keep na yung pregnancy from her whole family. Tapos her whole family thought that she was just gaining weight, no? But then they were all surprised na one day she locked herself in her room and that's when she gave birth to her baby. Okay, so ano siya from the boyfriend. Okay, but she did not declare it or reveal it to her family members. Okay, so luckily the baby survived in home delivery. Kaso, um, it was too late when they found out na stroke pala yung patient. So to be exact, yung hemorrhagic na stroke. Okay, so how did this happen? It's simply because the teenager's body is not yet well equipped to handle the effects of pregnancy hormones. So that is why they are considered as high-risk pregnancy cases. Kasi usually mga teens, good na um, who get pregnant early, most of the time they really present with hypertension, okay, hypertensive readings. Okay, so they need to be closely monitored so that there will be no injury to their baby. Okay, so yan yung pinaka-danger. Okay, so makastroke, um, makakos siya ng stroke. Okay, and what happened to that patient pagdating sa amin, naka-intubate na from the secondary level na hospital and sa amin na ex. Ayun. Okay, so ito siya. Okay, so this is the Pinggang Pinoy for pregnant and lactating women. So you may take a screenshot of this for your reference. Okay, so ito yung pinaka-important for pregnant women. Pregnant and lactating women. So ito yung Pinggang Pinoy recommendations. Okay, so for Go Food, they need to have energy-giving foods such as rice, root crops, pasta, bread, and definitely yung mga whole grains like brown rice, corn, whole wheat bread, and oatmeal. For Glow Foods, so definitely fruits and vegetables. For Grow Foods, they also need to have enough proteins. And as for water, drink lots of water every day for adequate hydration. Okay, so ito yung guidelines sa Pinggang Pinoy for women. Pregnant and lactating women rather. Okay? Okay, so here are the specific instructions. Okay, so you may take a picture of this one. Okay, so just be familiarized with this. Okay, so what if kasi, especially for your finals period, you will be assigned different types of patients. Tapos ang ma-assign sa inyo is pregnant or lactating mother. So these are the guidelines that you will be following when doing your meal planning. Okay, so kindly familiarize yourselves with this. Okay, so um, itong si um, yes, itong si FNRI, they really gave detailed instructions as to how um, to provide good and proper nutrition to your pregnant and lactating patient. Okay, so again, screenshot, although nandito naman siya sa Clipper file na na-send ko last night. Okay, so nutritional requirements. Okay, so babalik ulit tayo sa slight computation. Okay, so for energy, the normal TER, okay, total energy requirement or total energy required plus 340 kcal on the start of second semester. And for the third semester, it's your normal TER plus 450 kcal. And you have to choose nutrient-dense foods. Why? Because you need to supply the increased fuel demanded by enlarged metabolic workload. Okay, so I know you've heard of the phrase with regards to pregnancy na you're eating for two or you're living for two. Okay, because of this, no, so it's not just the mother who is living for herself, but also she is living for the baby, an unborn baby that is still growing inside of her. Okay, so to optimize the pregnancy and to also promote proper health and nutrition for both mother and baby, that is why we really have to properly compute or properly do our meal planning for this kind of patient. Okay, because they have increased metabolic needs. Okay, they need more fuel. They need more nutrients. Kasi itong si baby, the baby is living off on the mother's existing nutrients. Okay, and to meet those needs of the baby, the mother should be well nourished as well. Okay. So for carbohydrate, so we move on to the specific part. So carbohydrates is 60% of the TER per day. So the rationale for this one, it's because it's necessary to fuel the fetal brain. Okay, so fiber in carbohydrate-rich foods such as whole grains, vegetables, and fruits will help alleviate constipation. And to spare protein for the added tissue building requirements. So let's say, for example, again, you're starving. You're starving, and your body needs to use up all its energy reserves. Okay, so in the absence of in the absence of adequate carbohydrates, your body will target the protein. So, ano mangyari sa body natin kung nauubos si protein? The body will eventually become weakened kasi nakukulangan siya ng tissue building requirement. So, that is why dapat well supplied siya with carbohydrates so that the body will focus on carbohydrates alone for energy purposes. Okay? So that's for your carbohydrates. Okay, for proteins, 25 grams to normal. You're going to add 25 grams to normal protein requirement per day. So the rationale for this, the rationale or reasons rather for this is it's because of the baby's rapid growth. Okay, it also contributes to the development of the placenta, and due to the increase in maternal blood volume, okay, so you need more protein. Okay, next you also need this in the synthesis or creation of hemoglobin and plasma proteins. It also aids in the formation of amniotic fluid and also aids in tissue storage reserve. Okay, so powerhouse din itong si proteins natin. Okay, so that is why proteins have to be left alone. Okay, so they have to be left alone to do their thing. And for them to be able to do their thing, dapat adequate yung carbohydrate supply sa body ni pregnant, ni buntis. Okay? Next, we move to vitamin supplementation. Okay, so vitamin C, yung recommended daily allowance, or itong si AI, I think it's, forgot the term for this one. I think mas yung I niya is intake or acceptable intake, if I remember well. Okay, so for ages less than 18 years old, they need to have 80 milligrams per day for vitamin C. Pag 19 years old and above, they need to have 85 milligrams per day. Now, itong si vitamin C, the purpose of this is to aid in tissue repair and wound healing, plus for immunity. Okay, so itong si vitamin C, this is one of the common vitamin supplements that I see with my uh, with my postpartum patients, or even yung mga post-curettage or post-opo or post-CS na patients. Okay, so the usual package of medications, no, yung nag-encounter ko, definitely, as part of their home medication, they need antibiotic. Next, pain reliever, and then multivitamins, multivitamins plus ferrous, and then separate na vitamin C. Okay, so usually nakikita ko din itong vitamin C supplementation, lalo na pag CS yung post-CS yung patient. Okay, so again, that is for tissue repair and wound healing. Okay, needed din sa NSVD, especially though for those who experience having episiotomy and episiorophy. Okay, so they need to have good vitamin supplementation so that their wound will be they will be able to heal, or they will be able to recover from their wounds. Okay, lalo na sa episiotomy, episiorophy. Okay, so next you have your thiamine or your vitamin B1. Okay, so according to age ulit tayo. So if your pregnant patient is less than 18 years old, 1.4 milligrams a day yung need niya. Almost the same. Wait, I have to clarify this one. Baka wala pa din na-edit. Okay, for 19 years old to 50, okay, halos the same, 1.4 to milligrams per day. But ito I will just clarify this one kung 1.4 pa rin siya. Usually, nasa CHN ito na book sa may health promotion for pregnant populations. Just start this one for now. Okay, so rationale for your thiamine, it aids patients who are experiencing loss of appetite. So ano siya, kanang appetite stimulant siya. It also increases It helps increase metabolic workload. It also prevents beriberi and prevents leg cramps. Okay, so the richest food source for your thiamine is enriched or fortified whole grains and products. So again, ito yung picture ng beriberi. I think I also showed this to you in one of our old lessons before. Okay, so we have two types of berry. Okay, so we have the dry berry and the wet berry. Okay, so yung pinaka-key difference, pag wet berry, the problem of your patient is fluid overload. So may edema siya, especially sa dependent areas like the legs. As for dry berry, okay, so your patient appears skinnier and dehydrated kasi nauubusan siya ng fluids. Okay, so imagine nyo lang na your body is losing fluids, losing lots of electrolytes, no? So your patient will end up being dry. Okay, so pag nakukulangan ng fluids, that would mean that your circulation is also compromised. So since your body lacks fluids circulating around the tissues, no? So itong purpose ng ating fluids is to also aid in the transfer of nutrients to different tissues. But then, pag dry berry, low supply yung ating fluids. Okay? So that is how this results in rather yung signs and symptoms such as confusion, inability to speak, wrist drop, great weakness, okay, loss of tendon reflexes, burning or tingling, painful tender muscles, foot drop. Okay, so basically your patient is um, quite weak, okay, because kulang nga yung fluid volume niya. Okay, and these are the manifestations. Okay, so I already discussed this. Okay, so skip ko na lang ito. Okay? Anyway, just familiarize yourselves with the key differences between dry berry and wet berry. Okay? Anyway, na-discuss ko man din ito sa vitamin and mineral lecture nung prelim. Okay? Next, you have your pyridoxine or your vitamin B6. So, the recommended dietary allowance or the acceptable intake would be 1.9 milligrams per day. So, the rationale for this one is it helps prevent nausea and vomiting. It also prevents convulsions or seizure activity. Okay, so the richest food source for your pyridoxine are meats, fish, poultry liver, potatoes, legumes, non-citrus fruits, soy products. Okay, so ito yung for pyridoxine. Tingnan ko na. Ay, uy, 79. Dami pa ng slides dito. Okay, can you just give me a few minutes? Adjust ko na lang yung quiz. Wait lang ha. Sige, pause ko muna ha. Recording. Okay, so for your pyridoxine, okay, so it helps prevent nausea and vomiting, prevents convulsions. Well, I think I repeated this part already. Okay, so skip tayo sa next slide. Okay, ito siya, folic acid. Okay, so ito yung associated with neural tube defect prevention. Okay, so the recommended daily allowance for this one is 600 micrograms per day. Now, the purpose, okay, aside from preventing neural tube defects, it also aids in blood volume increase, and it also helps develop new cells. Okay, and ito siya, factors affecting neural tube defects. So, inadequate folate, also, yung neural tube defects in previous pregnancy. So, ang pinaka-common na neural tube defect is your spina bifida. Okay, so this is a condition in newborn babies wherein their portion of their spinal column is exposed in a sac. So, meron silang yung parang burot doon sa likod nila. Okay. Now, next, another factor affecting neural tube defects is your GDM, okay, so gestational diabetes mellitus, use of anti-seizure medications, maternal obesity, exposure to high temperature, such as fever or hot tub use. Okay, so it also, yung other factors affecting occurrence of neural tube defects, yung race, ethnicity. So this is common among Hispanic people. And also yung low socioeconomic status. Okay, so this is because they have less or minimal access to um, good health services, especially yung access to vitamin supplements for pregnancy. Okay, so next. Okay, ito siya. Okay, so aside from spina bifida, another type of your neural tube defect is your anencephaly. Okay, so this is common and always fatal type of neural tube defect. So it is characterized by absence of a brain, okay, or yung covering ng skull niya. Okay, so back when I was newly grad student nurse in San Pedro, I had my completion in the SPHDR NICU. And then, back then, Sundays ako naga-duty. Okay, so nag-attempt kong mga deliveries o mga newborn care. So, during one Sunday, we had an anencephaly case na patient. Okay, so, ang story nun, um, it it happened to the baby because of exposure to contraceptives. So, yung mga parents niya that time, mga medyo young, I think not even 20, mga 18 or 19 siguro. Tapos, yung history ng mother is, nag-pill siya, but then she had no idea na buntis pala siya that time. And when the baby came out, ganito yung itsura ng baby. Okay, so, tiny yung baby, tapos makita mo talaga na wala siyang protection around the brain. So, literally exposed yung brain niya. Itong sa picture na ito, very mild siya. Yung sa baby na encounter ko years ago, yung brain matter niya actually nag-spread dun sa crib niya. So, imagine nyo lang na, okay, change ko lang yung color kasi bloody hell man yung too red. Okay, medyo purplish siya tingnan back then. Okay, so the baby was lying in the crib, tapos literal good na neonatal ICU kasi critical care case itong patient. So, expose yung brain niya, tapos yung brain matter niya, doon lang nakaspread sa crib niya. Okay, so, yan. Okay. And then, obviously, poor prognosis yung pag ganito na case. So, sabi na ano ng parents kay dalhin na lang nila sa bahay tapos mag-wait na they'll just take care of it until ma-ek siya. Okay, so yun yung arrangement nila. Because hindi savable itong type of patient. Okay, so absence of brain or absence of protection of the skull, no? So if your brain is overexposed or if you have minimal brain matter, then you cannot expect that the baby will be able to regulate yung mga normal body function. So mamamatay po talaga yung baby pag ganito yung case. So even after so many years, I still remember this baby. So, luwi kayo siya tanawon. Okay? So, next we have your spina bifida, what I mentioned just a while ago. So, this is one of the most common types of NTD, characterized by the incomplete closure of spinal cord and its bony encasement. So, meron siyang parang may bulot siya dito sa back niya. Wait. Off ko muna itong draw. Okay, so ganito siya. Okay, so the baby's back looks like this. Okay, so normal findings sa ating newborn, dapat smooth yung curvature ng back nila. But in the case of your spina bifida, there is an outpouching dun sa may spinal cord ng baby. Okay, so portion of the spinal cord nag-protrude siya. Okay, tapos may sac siya. Okay, so ito yung spina bifida mo. Now, the problem here with your spina bifida, it affects the baby's balance and other bodily functions. So, may problem sila with physical coordination later on when the older they grow. Okay, so management for this one includes surgery and occupational therapy plus physical therapy. Kasi there are some instances, no, lalo na if you would search on YouTube, may mga patients na adults living with spina bifida. So they learned how to cope with their condition, despite their limitations. So if you're curious enough, no, I highly suggest na search for those types of patient stories. Okay, so para mas ma-appreciate good ninyo yung effect of chronic diseases to the lives of the patients and how it affects their daily living and also how it affects um, their caregivers. Okay, so to continue, okay, so highest food sources of folate, again, kindly familiarize yourself. So, hindi mawawala si liver, si atay. Okay, so we also have asparagus, spinach, avocado, orange juice. Okay, so mga green leafy vegetables plus yung citrus fruits such as your orange. Ito yung mga natural sources. Okay, pag fortified naman, we have pasta, okay, rice, and white bread. Okay, so kindly familiarize na lang yourselves with the food sources. Okay. Next, you have your cobalamin or your vitamin B12. So the recommended dietary allowance is 2.6 micrograms per day. So the rationale for this one is it aids in maturation of red blood cells. So again, your highest food sources are the following: meat, fish, poultry, shellfish, milk, cheese, and eggs. Okay, so ito yung sa protein. Okay, next you have your vitamin A or your retinol. Okay, so for those who are into skincare, di ba, may retinol din, retinol na infused in certain skincare items like yung mga creams, serums. Okay, so it also has significance when it comes to nutrition. Okay, so it is a derivative of your vitamin A. So the recommended dietary allowance is 18 years old and below, 750 micrograms per day. Pag 19 years old and above until 50 years old, 770 micrograms per day yung need nila. Okay, and the functions of your vitamin A or retinol, it is important for placenta functions. It also aids in the integrity of the epithelial cells. It aids in skeletal formation and it also tooth formation and normal bone growth. Okay, medyo magpaspas na po gamay ha. So far, okay kayo sa piece ko?
Yes po, ma'am.
Okay. Anyway, recorded naman siya. I will be posting it. I will be reposting the lesson together with the audio recording. Okay, para ma-access din ng 2E for next week. Okay, so food sources. Okay, so food sources of your vitamin A. It's not just carrot. Okay, so it also covers melon, tessa. I don't know the English equivalent for this one. Okay, actually, first time for me to read this type of fruit. Okay, so mango na ripe. So yung mga bright orange na foods or bright red or orange na foods. But your vitamin A can also be provided by green leafy vegetable sources as well, such as your malunggay, saluyot, tanglad, ang palaya leaves, kamote tops, alugbati ni siya dapat. Okay? Lettuce, onion leaves, and your liver. Hala, amazing. May vitamin A content si liver, si atay. No? So, ito siya. Okay, so, for me, personally, I do not focus on yung, yung microgram content niya. Okay, so, I would highly suggest no just be more familiarized sa food sources. Food sources under each vitamin or nutrient. Kasi most of there are some board exam questions na you would be asked to provide or to give examples of food sources for which vitamin or which nutrient. So that is why mas maging familiarized kayo sa mga food sources. Even yung sa NCLEX, common questions din nila is yung more on food sources and less on the microgram content. Kasi itong si microgram content, yung mga weight niya, it's falls more on the job description of nutritionists and dietitians kasi sila yung talaga mag-compute ng dietary intake ng patients in the hospital. For us, nurses, okay, so as early as now, claim it na magiging nurse kayo in the future. Okay, so focus on your food sources, okay, and they will help you a lot. So food are friends, not enemies. Ang kalaban talaga ng mga nutrition students is definitely computation. No, okay, so much for that one. We proceed to vitamin D. Okay, so vitamin D maintains normal calcium metabolism. It promotes normal bones and teeth formation. Okay, so it prevents tetany during infancy. So itong si tetany, it is a syndrome characterized by abnormal muscle twitching, cramps, sharp spasms of joints in wrists and ankles. So think, focus on the letter T. Okay, so um, for you to remember certain concepts or certain diseases, no, you find ways to remember the signs and symptoms more effectively. So for this one, think of the word T, twitching, twisting, tremors, yung shake, yung um, abnormal muscle movement. So T, okay? So twitching, tremors, okay? So for this one, your acceptable intake or recommended dietary allowance is 5 micrograms per day. And your food sources definitely mostly falls under dairy, such as your milk, margarine, butter. For other animal sources, yung eggs, liver, salmon, and sardines. Okay, so think milk and animal sources for your vitamin D. Okay? Yan, think milk. Think milk plus animals, no? Animal sources man. Animals. Okay? Ayan. Okay, so when you come up with your mnemonics, okay, most of them, come off as silly sounding, but then in the longer run, mas ma-remember ninyo. Okay? Kahit sa NCLEX review ko na, ang dami kong na-encounter na mga mnemonics, no? Some of the mnemonics are out of this world. But personally, no, your use of mnemonics should be based on your preferences or style of remembering things. Okay, so yan. Okay, so next you have your calcium. Okay, so your acceptable intake or recommended dietary allowance is 1,300 milligrams per day for 14 to 18 years old and 1,000 milligrams per day for 19 to 50 years old. So definitely your calcium is used for fetal bone development and dentition, yung teeth natin. Food sources, okay, so again we have milk, sardines with bones, tofu, cheddar cheese, and si broccoli. Next, we have phosphorus. Okay, so itong si phosphorus, okay, it's quite easy to remember. Sources of phosphorus cover all animal tissues or mga animal products. Okay, again, animals. Okay, so recommended dietary allowance is 1,200 milligram per day for 14 to 18 years old and 700 milligram per day for 19 years old and above until 50 years old. So this is involved in fetal skeleton building with calcium. So makapartner sila ni calcium and ni calcium. Okay, mag-best friend na sila. Okay? So next, magnesium. Okay, so recommended dietary intake 400 per day for 14 to 18, 350 for 19 to 30, and 364 31 to 50 years old. Bye-bye.
I'm going to Claveria.
Bye-bye. Next we have the purposes of your magnesium. So it is involved in bone mineralization. It also aids in normal muscle contraction and transmission of nerve impulses. So think neuromuscular. Okay? Ito siya again, neuromuscular. So highlight ko lang yung ano. Yung daming airplane na yun na on patrapin. Neuromuscular. Okay. So food sources that you need to be familiarized with, we have your spinach, black beans, soy milk, yogurt, oysters, and bran cereal, mga social na foods. Okay, so much for magnesium. Next, itong si iron. Okay, so iron's recommended dietary allowance is 27 milligrams per day. It is used for conservation of iron during pregnancy. Okay, it also helps in the maintenance of erythropoiesis. Okay, so itong si erythropoiesis takes place in the bone marrow, but it is stimulated by a hormone known as erythropoietin. So ito siya, it is secreted by the kidneys. Okay, so itong si erythropoietin is responsible for stimulating the birth or stimulating the production of red blood cells. Okay, so that is why pag naka-encounter kayo ng kidney or renal patient, especially mga chronic kidney disease or my renal failure na cases, usually they manifest or they appear pale, okay, because of having anemia. Kasi nadadamage yung kanilang kidneys, and because of that, they have that inability to um, regenerate yung mga red blood cells, normal red blood cell count in the body. And that is why usually binibigyan sila ng outside sources of erythropoietin. So subcutaneous injection siya. Okay, so it's usually given like in 1 week, 2 times a day siya. And what I remember, it is called ipoetin alpha. Okay, so cute siya na syringe. Social siya gamay tingnan. So ganito siya. Yan, ipoetin injection. Okay, so it is a pre-filled syringe. Ayan, ito siya. Ay, naka-plastic wrap man, oy. Ayan, ito. Okay, so back when I was a student and when I had that chance to inject ipowitin, parang gikip ko yung syringe kay kanang silly student nurse moment, no? Kay the thing with being a student nurse moment, every time you get to experience doing a new procedure, parang ang happy na ang ganda ng feeling, nasa cloud nine ka, and you would want to get all those items or mementos associated with it. So don't be like me, discard yun ni siya, ha? Kasi after every use, because whatever comes from the patient is considered infectious. So, i-discard yung tanan, ha? Hey, so, nagsundog-sundog man gud ko sa mga fourth year sa una, kay ang pati macro set, yung tubing good from the IV fluid, ginagawa gud nilang keychain. So, ano, student nurse stories. Yan. So, social siya na, no, syringe. It's pre-filled. Okay, and it is given subcutaneously. Tapos, cute din yung needle niya. Okay? So, for your iron, definitely it helps prevent anemia and it allows your body to have sufficient supply of hemoglobin. Okay, and food sources, okay, it's not just atay, but you also have clams, lean beef, black beans, enriched cereal, spinach, beef liver. Okay, so in the board exam, no, sometimes kanang mag ninja moves pud ang taga board of nursing because they know that students are only familiar with liver or atay. So when they give their multiple choice options, no, wala talagang atay, no? So you have to look for alternate food sources. So usually, if you want to give iron supplementation to your patient, and it also depends on the economic status of your patient. Okay, so let's say medyo financially challenged. So financially challenged ang patient mo. So you cannot force na 100 na magsige siya atay, no? So there are other cheaper sources of your um iron resources. So you will always be safe with um black beans, yung mga green leafy vegetables, no, yung mga kanang achievable sa patient. Okay? Okay, next we proceed to iodine. Okay, so or iodine. Okay, so recommended dietary allowance is 222 micrograms for 18 to 50 years old. It helps increase milk flow, and it also compensates increase in basal metabolic rate. It also helps prevent cretinism. So itong si cretinism, I mentioned this one in our lesson on minerals. Okay, so it is causes growth retardation. Okay, so food sources, iodized salt and seaweeds. Yan lang, one of the easiest food sources to remember. Okay, next you have zinc. Okay, so zinc, recommended dietary allowance is 12 milligrams per day for 18 years and below, and 11 milligrams per day for 19 years old and above. So this aids in protein synthesis, and it also aids in DNA and RNA synthesis. So more on cell structure po ito siya. So food sources, oysters, lean beef, yogurt, shrimp, enriched cereal, pork chop. No, so another important purpose of zinc is it also helps in building immunity. Okay, so next we have sodium. Okay, so sodium, as for recommended dietary allowance, you need to have 1,500 milligrams per day for 18 years old and below. And halos the same na naman. So I think, ano siya din. Oh, okay. Mark ko na lang ito. Okay, also 1,000 milligram per day for 19 to 50 years old. Okay, so it is used to keep minimal. You need to keep your sodium intake minimal to prevent edema and pregnancy-induced hypertension. So the rule here for your sodium is where sodium goes, water follows. It attracts water. Kung saan may sodium, may kapartner siya na fluid. Okay, so if your body has an excess of sodium, definitely you will have fluid volume excess. Okay, that is why you need to keep it within minimal levels. Okay, so food sources. Okay, so table salt, soy sauce, and processed foods. Hala, uy, di gutom ko. Okay, so that's for your sodium. Okay, so habits to establish more on other habits to establish preparation for healthy pregnancy. We have physically active. Okay, so staying active during the course of normal healthy pregnancy will improve the fitness of the mother to be, facilitate labor, help to prevent or manage gestational diabetes and gestational hypertension. It also reduces psychological stress. Okay, so kahit yung ambulation, yung konting exercise, or yung pregnancy-friendly na Zumba, basta physically active si mother, that is one of the ways for her to be safe and healthy during pregnancy. Okay, so ito siya. Okay, so do's. So you can exercise regularly, if not all, on days of the week. And just like with any other exercise, you have to do warm up with 5 to 10 minutes of light activity. Do 30 minutes or more of moderate physical activity. Do cool down with 5 to 10 minutes of slow activity and gentle stretching. Do drink water before, after, and during exercise. So, common sense lang, you have to keep your patient hydrated. Okay, so do eat enough to support the additional needs of pregnancy plus exercise. Okay, so don'ts. Okay, don't exercise vigorously after long periods of inactivity. Don't exercise in hot, humid weather. Okay? Do not exercise when you are sick. Okay? So, mas maluya ka plus ma-affect si baby if you insist on still exercising while feeling sick. Okay? Next, do not exercise while lying on your back after the first real trimester of pregnancy or stand motionless for prolonged periods. Okay? So, basically, the another purpose of moving around during your pregnancy is for um, improve circulation. Okay, so remember that during your pregnancy, you have a lot of extra weight on you. Okay, and there is pooling of blood in the dependent extremities, like in the legs. Now that is why some pregnant women manifest or show bigger or thicker legs. Okay, so that is because of the blood pooling. Okay, so and because of this, or to avoid this rather, we highly encourage mothers to be physically active. Okay, yung dapat gagalaw sila. Okay, so kahit yung simple na ambulation, that will do. Okay, basta may movement sila. So that is to prevent yung venous stasis or yung pagiging static ng blood in those dependent areas. Okay, next, don't participate in activities that may harm the abdomen or involve jerky, bouncy movements. Okay, yung tama-tamang Zumba lang, hindi yung pabigla like dapat mag-jump or mag-tumbling si mother. No, dapat safe si mother. Okay? And as much as possible, no, you have to encourage them, or they have to avoid yung mga extreme na weight bearing na exercises, like they have to carry weights, or they have to stay away, or they have to avoid exercises that will make them prone to falls or injury. Okay, so there was actually this one question that I encountered sa review. Okay, so you are dealing with a blah blah weeks pregnant woman, and you are advising her on the safest exercise to take. Okay, so ano siya kanang the choices were uh riding a bike, aerial yoga. Yung aerial yoga is yung mag-yoga good with the use of yung cloth, no? Yung masuspend sila sa ano, they would be hanging from the ceiling gamit ng yung cloth. Okay? So another choice was circuit training, yung 'di ba, yung stationary bike na cycling sila. And then the last choice was swimming. Okay? So let's see your answers. Okay? So what do you think is of the four, ano yung safest na exercise for the mother? Sige, i-chat lang ninyo. Let me see. Sige, pause ko lang muna. Okay, again, the question is, you're advising a pregnant mother on the safe exercises to do during pregnancy. Your choices are riding a bike, circuit training, aerial yoga, and swimming. So which of the four is the safest exercise that you can recommend? Sige, let me see other choices. Okay, swimming, yoga, who else? Okay, swimming, see who else? Yoga. Sige, answer pa more. Okay, let me see your answers. Yoga. Sige, tingnan natin if ready din kayo mag-NCLEX. Sige, sige. Yoga, swimming, sige pa, at least 5 more yoga. Okay. So, most of you answered yoga. Okay. Tapos yung swimming, dalawa. Okay, so answer reveal. So the safest exercise for pregnant women based on those four choices is swimming. Okay, so nasyakira pod ko ngano swimming. Okay, so my answer for that question was yung circuit training kasi yung pag-isip ko is kung stationary bike lang tapos my coach, so that would mean na the mother would be less prone to injury. Okay, kasi I did not choose yoga because there is a risk na yung patient will have risk for falls kasi what if mahulog siya. Okay, so this is how your aerial yoga looks like. Ito, ito siya. Okay, so this is how your aerial yoga looks like. So, I did not answer this one kasi the mother will be at risk for losing balance, mahulog siya, so prone siya to injury pag aerial yoga. Okay? Why not biking and why not circuit training? Okay, so this would make the mother exert more effort. Okay, so baka hindi ma-carry sa body niya. Okay, plus baka ma-out of balance siya sa bike. Okay, kahit stationary bike. Okay, because of the extra weight of the mother, baka ma-out of balance siya while she is doing biking, whether yung traditional na bike or yung um, stationary bike. So, which leaves us with swimming. Okay, so ang explanation ni Archer Review, okay, so ang sabi ng explanation, swimming is the safest because the mother has no risk of falling down, tapos less weight bearing siya na exercise. Okay, so hindi siya magiging prone to injury. Okay, so nag-overthink kasi ako why I did not choose swimming. It's because naisip ko, hala, baka sa sobrang bigat ni mother, baka mag-drown siya. So that is why I decided to go for another answer. But then, in the end, swimming, Judy, ay ang pinaka-safe na answer. Okay? Another benefit of swimming, it also helps condition the body. Plus, for those who are asthmatic, hindi din kayo mag-worry about being triggered by sweat. Kasi nasa water kayo, hindi kayo magpapawi. So, that's a good way of conditioning your body. With less stress, less risk of falling, less risk of losing balance. So, the thing with your NCLEX is that you have to pick the safest option. Okay? So, saan pinaka-safe yung patient ko? Okay? So, by the way, nag-review pa ko, wala pa ko nag-take. Okay? So, during the course of my review, ang dami kong nalalearn, hala, pwede ko to ma-share sa students. Okay? So, if and when you come across a similar question, tapos swimming is one of the choices, then by all means, choose swimming. Okay? Yun. Okay, so congrats to the two who selected swimming. Okay, so continue tayo. Okay. Yan. Ito, yung swimming, ito yung pinaka-center na picture, yung safest na exercise that mothers can do. Okay? The suitable activities for during pregnancy include brisk walking, swimming, indoor stationary cycling. Okay, so this is a milder form of your circuit training. Per my coach talaga siya. Okay, but then if you have to choose between use of bike or cycling and swimming, mas safe si swimming. Okay, prenatal yoga. Okay, itong si prenatal yoga this is different from aerial yoga. Itong si aerial yoga may risk of fall kasi what if mapunit yung cloth na hawak ni mother. Okay, so itong si prenatal yoga, they just simply use a mat tapos mostly floor-based yung kanilang stretching exercises. Okay? Other exercises are low-impact aerobics under the guidance of a certified aerobics instructor plus special exercise to prepare for labor and delivery. So, na sila squatting exercise, breathing exercise, pushing exercises. So, here are some examples. Yan. Okay, so stretching, Okay, stretching, tapos may mga pa-back moves konti. Okay, especially yung mga hip na exercises. Yan, to condition your body before delivery. Next, avoid harmful influences. So both maternal and paternal ingestion of harmful substances such as cigarettes, alcohol, drugs, or environmental contaminants can alter genes or their expression. So very common sense. Okay, so do not expose yourself or your baby to these harmful substances. Okay, so definitely cigarette smoking. So nicotine and cyanide are your contents of your are one of the major content two of the major contents of your cigarette. Okay, so these are toxic to the fetus. Okay, so it damages chromosomes, it limits blood supply, that will also limit delivery of oxygen, nutrients, and removal of waste. It also leads to growth retardation and may also cause behavioral or intellectual problems. Okay, and low birth weight. Okay, so these are the adverse effects under smoking. Okay, so medical drugs and herbal supplements. So, dili jud pwede magpatakag, tumar og tambal si mother, such as your aspirin and ibuprofen. Okay, so ito sila, they are non-steroidal, um, non-steroidal anti-inflammatory agents. And they can cause bleeding, especially itong si aspirin. Okay, next, drug abuse. So, definitely, mga amphetamines, marijuana, opiates, barbiturates, okay, kani siya. Okay, barbiturates, cocaine, and also environmental contaminants such as lead and mercury. Okay, these are toxic to the growing fetus. Okay, foodborne diseases such as listeriosis, which is caused by bacterium Listeria monocyte. So definitely the mother has to protect herself from infection during the pregnancy period, especially during organogenesis or pag during the remaining 7 months, because the baby becomes prone to uh, birth defects due to exposure to such harmful pathogens. Okay? Vitamins and minerals, megadoses. So anything in excess and anything in extremely small amounts, see, it's also dangerous to the baby. Okay? Dietary, okay, so low carbohydrates or fats can cause ketosis. Okay, so it is another life-threatening condition sa mother. Okay, so when you say ketosis, so it is the formation or accumulation of ketones. Okay, so definition-wise, itong si ketosis is a metabolic state wherein your body burns fat for energy instead of glucose. Okay, so this would lead to weight loss, okay, dry mouth, okay, fatigue. Okay, so malalo yung energy supply ni mother. Okay? And low energy going to the baby will also harm the baby's development. Okay, so sugar substitute are allowed as long as they are with FDA guidelines. Okay, so itong si aspartame or aspartame, okay, so this is not recommended in phenylketonuria. Okay, so ang explanation for this one, we can Okay, so this is more on the metabolic side. Okay, so let's say your mother has this condition, phenylketonuria. Okay, so if mag-take siya ng aspartame or any foods with sugar substitute, particularly itong si aspartame, um, okay, so ano siya kanang this will lead to the increase of phenylalanine in blood. Okay, so nana siya phenylketonuria daan. Okay, so the patient has an excess of phenylalanin. Okay, so in the presence of aspartame, mas mag-double yung level ni phenylalanin. Okay, so mas magiging toxic siya sa circulation. Okay, so ang cause, yung effect ng increased phenylalanin, just please take note. Okay, mga toxic effects. Okay, so it can affect major organs such as your kidneys, the brain. Um, okay, so it can lead to brain damage, seizures. Okay, so ito yung pinaka-major. Okay, so never ever mix aspartame or never ever give aspartame to a woman or to a pregnant patient with phenylketonuria. Okay, so yung pinaka-focus there is increased levels of phenylalanin will put the patient at risk for having brain damage and seizure. Okay? Generally, yung organ damage. Okay, so usually here yung effect sa brain, sa kidneys. Next, caffeine. Okay, so caffeine and cola beverages may result to fetal death. So remember that your caffeine is a stimulant. So if you're a coffee lover and you're pregnant, you have to give way, you have to sacrifice for your baby, no? Because ito si caffeine, okay, so technically it is ano kanang um is a stimulant, it's a stimulant drug. Okay, so if you give that to the baby, or if you have your coffee intake during pregnancy, it will also in turn stimulate the baby. The baby cannot withstand the effects of increase of caffeine in the body. Okay, and that is why they will end up dying. Okay, next, alcohol. So ito siya, it's one of the worst na substance abuse effects, especially on babies. So the fetus will have irreversible brain damage. So if your caffeine is a stimulant, your alcohol is a depressant. So pag depressant, it depresses yung neuromuscular function. So ang pinaka-major thing here is brain damage. Okay, so under this, you have growth retardation, mental retardation, facial abnormalities, and vision abnormalities. Now, the specific disorder or condition under this is fetal alcoholic syndrome. So, ang dagway sa baby na fetal alcoholic syndrome is like this. Fetal alcohol syndrome or alcoholic syndrome. Okay, so, parang yan. So, ito siya. Okay, so small eye opening, thin upper lip. So, it's physical wise, makita niyo sa face, okay, yung features on the face of the baby. And then generally, the baby will have when the baby will get older, meron siyang growth retardation, and the baby will also have yung poor physical mobility or coordination. So, saan yung other picture? I think I showed you a picture of this one during one of our other lectures. Okay, so ito siya. Okay, so think delayed growth and development. Okay, so yan yung consequence ng fetal alcohol syndrome. Okay, so much for that one. Ayan, sorry. Ay, hindi, may picture din pala. Sorry, it was a year since I last opened this lesson. Okay? Parang ako man din nag-add ng visuals when I discussed this the first time with my students at 2H. So ito, another actual picture of a baby with fetal alcohol syndrome. Ito siya. Okay? Next, you also have dietary management for common maternal discomforts. Okay, for nausea and vomiting, morning sickness. This is most common during the first trimester. Okay, so the most popular theory is that morning sickness is the body's reaction to pregnancy hormone, specifically your HCG or your human chorionic gonadotropin, and progesterone and estrogen. So dietary management for morning sickness, basically small frequent feeding tayo, but yung feeding should have high carbohydrates and low fat diet. So you can advise the mother to eat dry toast or crackers, jellies, candies, and gums. Okay, hindi siya makakatolerate ng food in large amounts kasi isusuka lang niya. That is why small frequent feeding tayo. And yung mga food na hindi masyado heavy. Okay? Chemically bland diet. So avoid excessive spices and no offensive odors. You may also give cold or frozen drinks can be better tolerated in morning sickness. So common board exam question. So if you will see ice chips in one of the choices, go for ice chips kasi recommended siya sa pregnant mother na nag-experience ng nausea and vomiting. Okay, so do not drink juice, water, milk, coffee, or tea when nauseated because all the more na ma ma-increase yung nausea and then the patient will end up vomiting. Okay, so may stimulant effect itong si juice, water, milk, and coffee. Okay, basically any caffeine containing product. Okay, so next, management on waking, get up slowly, okay, and eat small frequent meals whenever hunger strikes. Okay, so room should be in proper ventilation. The mother should also have adequate fluids between meals. Next, we have heartburn. Okay, so pregnant women are prone to having heartburn due to acid reflux. Okay, so the bigger the uterus grows, naiipit din yung tiyan ni mother. Okay, and this will lead to acid reflux. Okay, so acidic stomach causing burning sensation. So there is pain felt in the chest, in the esophagus, which is located close to where the heart is. So the growing fetus weakens the lower esophageal sphincter, which is the main barrier of gastric reflux from the stomach to the esophagus. Okay, so again, you have to give a chemically bland diet, avoid spicy and greasy foods. Foods that may help reduce the symptoms are vegetables, ginger, oatmeal, non-citrus fruits, lean meats, seafoods, egg whites, and healthy fats. Okay, and for the management, you have to relax and eat slowly. Eat small frequent meals, drink liquid between meals, sit up while eating, wait 1 hour after eating before lying down, and wait 2 hours after eating before exercising. So basically, you are avoiding triggers na ma-hyperacidity si mother. Okay? Ito siya, constipation. So this is due to the pressure exerted by the developing fetus on the digestive tract. And this is one of the common discomforts of pregnancy. So due to increase of hormone progesterone during pregnancy. So you have to advise the mother to increase fiber in her diet. So more fruits and vegetables and increase fluid intake, at least 8 glasses of liquids per day. So you have to also advise the mother to exercise daily, respond promptly to the urge to defecate, use laxative only as prescribed by the physician, and ay wala di ay sumpay. Okay, use laxatives only as prescribed by the physicians. And usually, no, kanang if you are handling mother for delivery, very common na makikita mong hemorrhoids. Okay, that is the effect of constipation. Why? Kasi mag-strain sila. Okay, mag-exert sila ng extra effort to push their poop out. That's why nakaka-hemorrhoid sila. And to avoid this, you have to increase fiber and fluids. Next, edema, yung swelling. Okay, so this is caused by pressure of enlarging uterus on the veins that return fluid from the legs. Okay, so diet, they have to have moderate sodium. Okay, so less consumption of salty foods, such as sauces, condiments, and gravy, canned goods, processed foods with preservatives. You can also advise them to consume natural sodium-containing foods. And this is because sodium contributes to water retention. So, ang gagawin natin, advise the mother to have enough rest, and they have to lying down position when sleeping. Usually, dapat naka-left lateral sila. Ito also improve yung yung maternal fetal circulation. Next, you have your leg cramp. So there is a sudden contraction of the gastrocnemius muscle. So this is due to the decline in serum calcium levels related to calcium-magnesium imbalance or caused by calcium or magnesium deficiency. Okay? So the thing with your calcium, no, pag hypocalcemia, the patient becomes more irritable. Okay, so mas nakaka-experience siya ng cramping pains. Pag hypercalcemic, opposite siya, mas manifest ng body weakness si mother pag hypercalcemic siya. Okay, same thing with your magnesium. Okay, so increased magnesium levels in the body leads to respiratory respiratory depression plus muscle weakness. Pag less ang magnesium level ng patient, doon siya mag-manifest ng mga cramps, tremors. Okay, so yun yung effect ng um, calcium and magnesium, okay, when in low amounts. Okay, so for diet, you have to give them calcium rich foods, give potassium rich foods, and magnesium rich foods. So as for other management, they have to stretch their calf muscles and stretch, stay active, stay hydrated, choose proper footwear. Okay, so hindi sila pwede sa heels. Okay, so ano siya kanang flat. They have to wear flat shoes because wearing heels would add extra strain on their spine as well. So dapat better if flat and well shoes with good support. Okay? Next, so either rapid weight gain or loss. Okay, so dietary management for obese, pregnant patients. So rapid weight gain may result from excess food intake and lack of physical activity. So you have to remember that you should not give an addition of calories and protein. So we give more nutrient-dense food sources rather than energy-dense foods. Next, make your patient's cravings constructive and let them eat balanced meals and refuel often. Okay? Now, for underweight, pregnant women, additional calories and proteins must be followed. And you have to give them nutrient and energy-dense food. Okay? So, pwede sila sa 2. Next, for pregnancy-induced hypertension. So, or the main gestational hypertension in which rapid weight gain is one of the main issues. Okay, so high blood pressure during pregnancy may cause intrauterine growth restriction and affected din yung circulation going to the baby. So this is characterized into either preeclampsia or eclampsia. Itong si preeclampsia, wala pa siyang seizure. But in eclampsia, your patient is already manifesting seizure activity. Okay? So severe preeclampsia or eclampsia, okay, so you have to watch out for the patient experiencing headaches, blurred vision, or visual problems, inability to tolerate bright light. Your patient may also exhibit or manifest nausea and vomiting, urinating in small amounts. So what makes preeclampsia or eclampsia quite dangerous is that there is um, renal involvement, meaning your kidneys are in danger of being damaged. Okay, that is why if you have a patient diagnosed with either preeclampsia or eclampsia, dapat naka-fully bag catheter siya. Okay, because you want to check if the patient's kidneys are still working. So you have to note for adequate urine output. An absence or minimal amount of urine output would signal that the kidneys are not functioning properly. Okay? Next, shortness of breath, seizures, convulsions. Okay, so ito yung makikita natin pag eclampsia. Yung pre-eclampsia, wala pa seizure na happen. Okay? Next, okay, so dietary management. Okay, so definitely you have to promote optimum nutrition to your patient. Also, protein and high biological value proteins, to be exact. Okay, so supplementation, so common vitamin supplements sa pregnant patients are iron, okay, so dark green leafy vegetables, calcium, rich foods like dairy products, milk curd, soya milk, vitamin A, carrots, egg, pumpkin, spinach, green leafy vegetables. So think green and think orange. Okay, salt restricted diet as well. Okay, anemia. So this is a result from deficiencies of iron and folic acid. Okay, so simple ang management. It's more on iron supplementation, folic acid, and vitamin C supplementation. So itong si vitamin C, may magic power siya. Okay, so if you take iron and um, vitamin C at the same time, vitamin C will allow for the increased absorption of iron. Okay? So if your vitamin C will if so if so uh, pag vitamin C tapos may partner siya na iron, it's a good partnership. Kasi vitamin C will provide the way or help provide the key para mas ma-absorb si iron. Okay? So what to avoid? Okay, so if you're taking iron, you have to avoid taking coffee. Why? Because coffee will give an opposite effect. If your vitamin C will help in promoting reabsorption of your iron, itong si caffeine or coffee, it will um, disregard or it will weaken the effect of iron. Hindi siya masyado absorb ng body okay, in the presence of coffee. Okay? So next, we eat foods rich in heme, such as liver and egg yolk. Eat more on dark green leafy vegetables. Okay, so that's for your anemia management. Next, gestational diabetes mellitus, or this is caused by a hormone made by the placenta such as estrogen, cortisol, and human placental lactogen can have a blocking effect on insulin. Okay, so meron silang effect na insulin resistance. So this may result to glucose buildup in the blood instead of being used by cells. And because of this, napupunta kay baby, so si baby nag-consume sa glucose content ni mother, kaya mag-increase siya in size. Hence your macrosomic baby. Now, for dietary management, give complex carbohydrates and more in green leafy vegetables. Avoid foods that are high in glycemic index. Promote high fiber diet and avoid products that use added sugar and trans fat. Okay, and then okay. Next, we have adolescent pregnancy. So I mentioned this one already. So by now, you all know that teenage pregnancy is considered a high-risk pregnancy. Okay? Number one, because they cannot still tolerate the effects of pregnancy hormones. And number two, because of nutrient deficiency. So such as your vitamin A, D, folate, and your minerals, ferrous, zinc, and calcium. So risk in adolescent pregnancies or teen pregnancies, they give birth to low birth weight babies, and the possibility for preterm deliveries are high. And because adolescent mothers' physical and mental growth and maturity of personality are not completed yet, so the uterus still has not reached its full maturity and is not capable of handling pregnancy. Kasi some instances, no, some teenage mothers, they end up having CS, no? Because the baby is already under distress and hindi kaya ng body nila yung um, effects ng pregnancy and labor and delivery. Okay? And because adolescent needs to meet their own nutrient requirement for their own growth and development. Okay, last few slides na. Okay. Lactation na tayo. Okay? Um, This is the period of milk production by the mammary gland. So the hormones are responsible for milk production are the following. So progesterone, prolactin, and oxytocin. Now, the nutritional requirement, energy, add 330 kcal per day added to normal requirement. But if your patient is overweight or obese, there is no need for addition. Now, a healthy mother can produce 25 ounces of milk per day. So 25 ounce is to 500 kcal loss per day. That will also have a weight loss of 1 to 2 pounds per month for the first 6 months of lactation. Okay, so this is a diagram just showing the effect of the hormones on the milk production. Okay, so nutritional requirement for energy. Ay, wait. More nausab ni siya. Okay, na-repeat lang siya. Okay, so protein, add 16 grams per day for the first 6 months, and then add 12 grams per day for the next 6 months. Hala, weird lagi. Okay, 9 months mo ng pregnancy. Okay? So in every 100 ml of human milk, there is a loss of 1.2 grams of protein from the mother. Okay, so again, we have your mineral and vitamin supplementation. Okay. Wait. Sorry. I said it wrong. Okay, so this is after birth. Okay, after birth ni siya. Okay. So in the first 6 months following birth, you add 16 grams of protein per day. And then for the next 6 months, okay, after the first 6 months, you're going to add 12 grams per day. Okay, and then in every, na-stay ko na ito. Okay, so minerals and vitamin supplementation, hindi man nagbago. Okay, so you have your calcium, zinc and iodine, and vitamins A, C, and D. And definitely water and other fluids because you need to keep the mother hydrated. Okay? Kasi if well-hydrated si mother, meaning good din yung supply ng breast milk niya. So, 3.8 liters a day. And in some other resources, it's 3.1 liters yung baseline. So for colostrum, we already talked about this one, yung sa infant. Okay? It is the first milk that is produced after birth. Okay, so just just review on the next few slides on your own. Okay, benefits of breastfeeding. I will not put emphasis on this one because you already went through this sa MCN. And I remember may isang group na nag-breastfeeding lecture nung health edu natin. So, piece of cake niya sa inyo ha. Okay? So, proper attachment during breastfeeding, ito yung mga guidelines. Yung pinaka-important is head-to-head, head-to-head, baby's tummy to mother's tummy, and dapat covered yung areola and not the nipple. Okay? And chin to breast sila dapat. Okay? So, just analyze this one. You're already familiarized with this anyway. Okay, human milk storage guidelines. Okay, so yung freshly expressed or pump, in room temperature, it's good for 4 hours. Pag naka-refrigerate, it's good for 4 days. But if it's in the freezer, it is good for 6 months. And up to 12 months is still acceptable. Mao ni siya ang nice basta breastfed. Okay? Now, what if your breast milk is thawed or previously frozen? It's going to be good for 1 to 2 hours if it's kept at room temperature. It's good for up to 1 day if it's in the refrigerator. And pag freezer, never refreeze human milk after it has been thawed. Okay, and lastly, leftover from a feeding, like the baby did not finish the bottle. Okay, use within 2 hours after the baby is finished feeding. So, mao ni siya ang issue sa bottle or formula feeding na babies. Okay, so you're only allowed to use the reconstituted milk within 2 hours. After that, it becomes harmful to the baby. Okay, so usually that's when the babies will have more instances of stomach upset or reactions sa milk, okay, na overexpose. Now, breastfeeding contraindications, breast cancer, definitely. HIV, okay, so HIV is transmitted via secretions, okay, secretions especially. Okay, so no ang breastfeeding pag HIV positive si mother. Okay, so sila lang ang pwede bottle feeding. Next, active TB also, breastfeeding contraindications po ito siya. Common problems in breastfeeding are the following: inverted nipple, baby has a narrow mouth, sore nipples. So itong si sore nipples, it is caused by poor latching. Okay, so malalaman ninyo if poor yung attachment ng baby is if the mother will complain of sore nipples. Why? Kasi doon nag-suck si baby sa may nipples banda. Okay? It is painful. That is why sa areola sila dapat. Okay? So another thing with your areola is that more milk is sucked out if the baby covers the areola. Next, baby falls asleep during feeding. Super aspiration. Risk po ito siya. Okay? So I always instruct the mothers in the OB ward back then na hindi sila pwede matulog okay, habang nag-breastfeed. And all the more din, hindi dapat matulog si baby habang nag-breastfeed kasi the baby will be at risk for aspiration. To choke siya sa kanyang sariling milk. Okay? Okay, terms associated with breastfeeding, almost done. Okay, so engorgement is the overfilling or the enlargement of the breast with milk. Pag letdown reflex naman, it is the reflex that forces milk to the front of the breast when the infant begins to nurse. And mastitis is the infection of the breast. Okay, so sucking rooting reflexes is a reflex that causes an infant to turn toward whichever cheek is touched in search of a nipple. So, i-stroke-stroke yung side ng cheek niya, and then the baby will look to your direction, and then mag-open siya ng mouth. Okay, kasi mangita siya ang nipple ni mother. Okay, so this is how your mastitis looks like compared to your engorged breast. Okay, so last, ito yung mga pictures. Yun naman. Okay, so this ends our lesson. Mag-stop share ako. I'm going to